Melasma is a common skin condition. It causes patches of discoloration on the skin. These patches are usually brown or grayish-brown. Melasma typically appears on the face, especially on the cheeks, forehead, nose bridge, and upper lip. It can also appear on other parts of the body like the forearms and neck. Melasma is harmless. However, it can be a cosmetic concern for many people. The good news is that there are effective ways to manage and treat melasma. Understanding the causes and available treatments empowers individuals to address this skin condition effectively. Melasma affects people of all skin types. However, it is more common in individuals with darker skin tones. These include those of Latin American, Asian, African, Middle Eastern, and Mediterranean descent. The reason for this increased prevalence is the higher concentration of melanocytes in their skin. Melanocytes are the cells that produce melanin. Women are far more likely to develop melasma than men. This is because the condition is often linked to hormonal changes. In fact, melasma is sometimes referred to as the mask of pregnancy. It is common for women to develop melasma during pregnancy. Hormonal changes associated with birth control pills and hormone replacement therapy can also trigger melasma. Melasma occurs when melanocytes, the cells responsible for producing melanin, become overactive. Melanin is the pigment that gives our skin, hair, and eyes their color. When these cells produce too much melanin, it clusters in patches, leading to the hyperpigmentation characteristic of melasma. The exact reasons why melanocytes become overactive in certain individuals remain somewhat unclear. However, several key triggers and contributing factors have been identified. Understanding these factors is crucial for effective melasma management. One of the most significant triggers for melasma is sun exposure. Ultraviolet (UV) radiation from the sun stimulates melanin production. For individuals prone to melasma, excessive sun exposure can trigger an overproduction of melanin, leading to those telltale dark patches. Hormonal fluctuations are another primary culprit behind melasma. Estrogen and progesterone, two key hormones involved in the female reproductive system, can stimulate melanin production. This explains why melasma is much more common in women, especially during pregnancy when hormone levels surge. Section 4. Identifying and diagnosing melasma. What to look for. Recognizing the characteristic signs of melasma is the first step towards seeking appropriate treatment. Melasma typically presents as symmetrical patches of hyperpigmentation, meaning the discoloration appears in a similar pattern on both sides of the face. These patches are usually brown or grayish-brown and have a distinct border. The most common locations for melasma are sun-exposed areas of the face, particularly the forehead, cheeks, nose bridge, and upper lip. However, melasma can also affect other areas occasionally, such as the forearms and neck. Diagnosing melasma usually involves a visual examination of the skin by a dermatologist or qualified skincare professional. They will assess the pattern, color, and location of the pigmentation to differentiate it from other skin conditions that can cause hyperpigmentation. In some cases, a dermatologist may use a special tool called a Wood's lamp to examine the skin more closely. A Wood's lamp emits ultraviolet light, which can help visualize the melasma more clearly and determine the depth of pigmentation. Section 5. Treatment options for melasma, a multifaceted approach. Addressing melasma effectively often requires a multifaceted approach that combines different treatment modalities. The goal is to reduce the appearance of hyperpigmentation and achieve a more even skin tone. The specific treatment plan will vary depending on the individual's skin type, the severity of their melasma, and their lifestyle. Topical treatments are commonly prescribed as a first-line approach for managing melasma. These typically include creams, lotions, or gels containing ingredients that help lighten the skin. Chemical peels are another treatment option for melasma. These involve applying a chemical solution to the skin, which causes the outer layer of skin to peel away. This can help to reduce the appearance of hyperpigmentation. Laser therapy is a more aggressive treatment option that can be effective for some individuals with melasma. Lasers work by targeting and destroying the melanocytes that are overproducing melanin. However, laser therapy for melasma requires caution, as it can sometimes worsen hyperpigmentation, especially in individuals with darker skin tones.